If they're not feeling this trigger and that reflex, then it's going to be a little bit harder for them to do it. There are, if you have a shorter, like a pretty short or a flat or an inverted nipple, please contact us privately and we will talk about ways that you can work through some of those challenges now, because breastfeeding will be, it's going to be something you'll have to work a little bit harder than somebody who has a full out nipple. So just an FYI, feel free to reach out. If you don't know or aren't sure, then we'll get on a video call and kind of work through all those things. So that's probably one of the first things I see all the time. So if your nipple is shorter or inverted, it's going to take a lot more work for that baby to pull the nipple out. And that can cause some more trauma or damage or discomfort in the early days of breastfeeding. Same concept that if your baby's anatomy is a little bit different, a lot of us have probably heard about tongue ties or lip ties now. And that's just where the tissue that holds your tongue to the bottom of your mouth. Yeah, I don't know if you can see it. But anyway, that tight tissue, that band, if it's really short, it doesn't allow babies to protrude their tongue out as much so that they can use that muscle to pull the nipple back to the roof of your mouth and the back of their throat to draw the milk in. So that's another one of those two big things that takes extra time and effort and energy and tears sometimes to work through to get to a better breastfeeding thing. It's not that we can't work through them, but the sooner that we are aware of them and start working on them, the sooner then we can correct them with the least amount of, I call it nipple trauma. So if your nipples are cracked or bleeding postpartum, that's nipple trauma. It shouldn't be that way. That means there's something wrong. Either the latch on the baby needs to be corrected, or your nipples need to be drawn out more and worked on pulling out. So those are kind of the things that we do.
The analogy that I like that someone once said to me about breastfeeding is, if there's a pebble in your shoe and you're walking, it causes trauma to your foot. So we need to stop and take the pebble out, right? And so that's kind of the thing. If you're having a painful breastfeeding experience, that is one of the first, reach out to us, even if it's overnight postpartum, so that we can help you figure out the pebble that's in your shoe that we need to take out. And we have a lot of tools for that. There are a lot of resources, things that we can utilize if you have short or flat or inverted nipples, but it's just something that we want to address right away.
Yeah.
The other thing, and then we'll keep moving on because we have a lot, looks like we have a lot of really good things to cover, is fluid. We've talked about this in the interventions workshop a little bit, but when you have a lot of fluid in labor, it can cause edema in your breast, which is where the fluid, the IV fluid, goes to your breast, and that can cause flat or short nipples if you don't already have them. So again, that's one of the reasons, one of my biggest passions is how birth practices impact breastfeeding. And that's one of the birth practices that can impact your breastfeeding journey, which is why we're advocating for not doing routine IV fluid unless medically necessary.
Yep. Good. Next question is a good one. They've heard that you should feed your baby laying down so that they don't get used to being picked up with breastfeeding to make weaning at 1 year or so easier. Definitely a false scenario. I don't think, I would say the keys to early breastfeeding success is for mom and baby's comfort, right? So whatever position you can be in that you can be comfortable breastfeeding, that's the position you should be in. To force yourself into any one position would be such a hindrance for you and that baby. So we would say, try to let that out your mind and focus on being comfortable. We see, this is going to lead me to a couple of my soapboxes. We see often with breastfeeding mom, I don't have my baby and I don't know where that box is, so I can't go grab that. Many breastfeeding mom, when they first start to nurse, they'll kind of hunch over and you bring your breast down to your baby. And that's like nursing mom's neck. It's going to cause you backaches and discomfort and all this stuff. The trick is to bring baby up to you So you're sitting back and you're relaxed, and that baby will then latch a little bit easier. So try not to do this. That's a positional thing. One of my biggest things, try to come back. Partners, this is a great one for you guys to remind your partner to bring baby to you. Bring baby to you. Don't go to baby. Bring baby to you. So practice that now and use those loving words in the postpartum days when she's crunched over and saying her neck hurts. Then you're going to help her get all the pillows so she can be more comfortable and leaning back with baby.
Well, I'll piggyback on what Jackie just said. So here's where understanding the hormones are important. One of the hormones that you release when you're breastfeeding is a hormone that makes you and baby sleepy. So this idea of that you shouldn't nurse your baby to sleep is actually countering the physiological aspects of breastfeeding. Breast milk helps your baby to fall asleep. And so especially in those early days when sleep is a priority, that's one of the best ways to help your baby get to sleep. Now, as your baby and your breastfeeding journey progresses, there are things that you can do to help facilitate a routine that fits your lifestyle and your family's choices. And that's something that we can help you navigate. But in those early days, nursing your baby to sleep is going to be beneficial for you and baby. And it's physiologically designed that way. Yeah. Does that answer that question? That's not one that we see. That must be directed just to Jackie.
That your milk can take a few days to come in. So around 32 weeks, generally speaking, you're going to have milk already. You have colostrum, which is a high fat content, high caloric, dense milk already. It's like it's still your milk, but it's called colostrum. And that will feed your baby and nutritionally, provide everything that baby needs until your full milk supply comes in and you have an abundance of milk. So that transitional milk that will then change. It often will take anywhere from 2 to 5 days on average for a full milk supply to come in. That does not mean you do not have milk. You have milk from day one. You have that colostrum. That's all that baby really needs. So trust that process. This is a hard one for a lot of us that like numbers and stats and science and concrete information. It's really hard to not have that knowing how much your baby's getting by seeing the ounces go down in a bottle, right? When you're bringing a baby to your breast, especially in the early days, and you're not feeling a big supply of milk in your breast yet, trusting that they're getting that colostrum and trusting that they have the input that they need can be a big learning curve for a lot of us. So try to wrap your head around that now, understanding that your body is going to provide, generally speaking, what your baby needs in those early days. And the key ways that we're going to utilize to know that is the baby's output and the baby's weight gain. Two things that nobody can change, right? If your baby is having the output that we expect, so 1 diaper per day of life, so day 1, we expect 1 pee, 1 poop, right? On day 2, 2 and 2. Day 3, 3 and 3. Day 4, 4 and 4. And then continuing 4 on, generally speaking, breastfed babies will need to be changed 12 times a day. 12 poopy diapers on average in the first few weeks, every single day is typical. So understanding though that in the early days, we're expecting very little. Their systems have to really adapt to a lot, right? They're not used to having milk that they have to digest, and their bodies are learning how to, the microflora and all that stuff is kind of adapting and learning how to digest and absorb all the nutrition through their system. So it's a process for you as well as your baby. So don't be shocked by that. The weight gain is another thing that you will probably hear your provider talk more about, your pediatrician, in the early days postpartum than you would be expecting. It is one of the key things that we use to judge how baby's gaining or input that they're taking after we know that within the first few days of your baby's life, we expect them to lose weight, right? This whole birth weight thing changes within the first 48 to 72 hours. That's common. We expect that. Don't be freaked out. Often providers will put a big emphasis on input baby's taking and needing to supplement or add formula if your baby has lost more than 10% of their body weight. 10% is kind of that line where we would say it's still within the normal range, but if your baby's lost 10%, then you need to be consistently working with a lactation counselor or a lactation specialist to find out where the challenge might be. Is it an intake issue? Is it your baby you had tons of fluids during labor, you were induced for 3 days and you had IV fluids and all this stuff, and it's just a waterlogged baby that needs to kind of dry out in a sense? And so working through some of those are the first questions that we do before we talk about needing to add more milk or increase your supply. Providers, I say this to everybody, I feel like I can't say it enough. Pediatricians are not lactation trained. They have almost no training whatsoever in breastfeeding or lactation production, and often will only look at the patient, which is the baby, right? And sometimes that can make a really big challenge to someone whose really big goal is to make sure that they exclusively breastfeed, and can hinder that early on by suggesting supplementing or suggesting that you do something that you don't need to do.
Yeah, I think that can't be emphasized enough. So I'm going to say it again. Pediatricians, it is not part of their boards to become a pediatrician to have breastfeeding training. And so what that means is their standard response is formula and supplementing. And actually, the mindset of what is normal is a formula fed baby.
Right.
And that's a very different, a formula fed baby is a very different, has very different considerations than a breastfed baby.
Now, wise and chart wise and intake wise, right? So
yes.
Lots to consider. Just putting it this way. So if you think about, if you have a mom who's choosing not to breastfeed for whatever reason, from the get-go, they're given a bottle of 2 ounces of formula in the birth room, and they are told to give this bottle of milk to your baby as much as they want to take, right? Babies are kind of like fish, and they'll eat as much as they could possibly take in, and then they'll vomit anything that they can't hold.
Babies are kind of like me.
So.
I mean, give me something and I'm going to eat it until I feel sick.
If you have a mom who's choosing to breastfeed from the start, she's going to produce colostrum. 6 drops of colostrum, 6 drops of milk from your breast is a meal in the first few days, right? That's all that your baby needs to take in. That nutritional substance is adequate enough to provide the nutrition that your baby needs. So that right there is the big difference that we see in breastfed and formula-fed babies. So that's just some food to think about, and understanding the drastic difference. Without concrete information, providers only have, what they're being told, and it's not something that they're used to going on non-concrete information.
Yeah. Also, this is really cool, and I didn't realize this for a long time. So we have colostrum, and the contents, the formula, or no pun intended, of colostrum, that liquid gold that we talk about as being so beneficial, actually stays in your breast milk. That content is the same, and then there's just other things added to that when your milk comes in. So the idea that you don't have milk when it's colostrum is something that I think can cause people to question the breastfeeding in the early days, when actually that's the most concentrated nutrients that your baby needs. And then as your breastfeeding journey grows and as your milk supply increases, more things are added, but the colostrum stays the same. Super fascinating.
Some babies have difficulty breastfeeding. That's usually an anatomy issue, or if you have a baby who's born premature or who has a recessed chin. So there's some, cleft palates. Those can sometimes cause issues. Generally speaking, your baby and you were made to breastfeed, right? So generally speaking, most babies, although it might take, some of us have a little bit harder of a time learning that skill, but generally speaking, the two of you were made to do this without any major anatomy issues. We would say typically you're able to work together.
But birth practices, and we would argue actually that immediate postpartum, those 2 hours postpartum, how your medical providers respond in those first couple of hours can significantly increase the complication, like your ability to meet your breastfeeding goals. And so it might not be a baby thing. It might be the things that happened immediately after birth or during your birth that can play a role in that. And so we're taking we take a full picture of that in order to help try to hone in on what is specifically causing that to be a difficult time.
Yeah. The one thing I always say when we talk about this topic is if for some reason you are not able to do skin to skin or get that baby to your breast within the first 2 hours, please don't think that you won't be able to breastfeed. There are babies that are born preterm or that are very sick that go to NICU for weeks before coming to the breast, and they are still able to regain that breastfeeding relationship and breastfeed for years to come. So it's not ideal, and it will take work later on, but please don't think that it's not an option if something happens and you guys are separated. But we do know that research shows that immediate skin to skin and uninterrupted skin to skin, which is the key, uninterrupted skin to skin, keeping you and your baby together until they have that first breastfeeding opportunity is significantly going to increase your goals, your long-term breastfeeding goals. Women tend to breastfeed for like 6 months longer or something like that. It's a crazy stat. If you have uninterrupted skin to skin. So no removing baby for weights, because we really don't need to know the weight of the baby in the first hour. It's nice to know, but it's not needed.
Also, the thing that we see is if, again, we've talked about the tongue tie issue, that is often a genetic thing. So if either you or your partner has tongue tie.
Turn to your partners and look at your tongue and see how tight their tongues are. If you know either one of you has, I should call Bubba in here. My son, my 14-year-old has a tongue tie that we didn't release. And I didn't know it back then. 14 years ago, we didn't talk about tongue ties. But he's fine.
Or if your partner can't stick out their tongue past their lip.
Yep.
Like, look at, guys, this is one of my talents. I can touch my nose.
So gross.
If you can't do that, or if they stick out their tongue and it creates, as the tongue comes out, the tip goes inward and is like heart-shaped, those are all indications of tongue ties.
Yeah. And it is genetic. It's definitely a genetic thing. So,
yeah. Or if your mom had really, really painful breastfeeding, then maybe you have a tongue tie.
I would say it's probably one of the number one things that I see when someone says that they're having a really painful breastfeeding relationship. I mean, I don't know what the number is, but really, really, really high chance it's a tongue tie issue with baby.
Yeah.
Almost always, honestly.
And here's another thing, and then we can move on because we're talking about this. But my mom, as most of you know, was a labor and delivery nurse back in the 70s. And she said back then, the doctor would cut the cord and cut the tongue tie if they saw it. And then most of us probably were bottle fed. And so when you're bottle fed, it doesn't play as big of a role in identifying it as a problem. So as breastfeeding became less of a thing and bottle feeding became more of a thing, most of our tongue ties weren't clipped. And now it's just recently in recent years where they're identifying, oh, this is a big problem. So yeah. Cut the cord, cut the tongue tie. That does not happen anymore.
Yeah, this is a great question. I heard I might not want to connect with my baby. So this is a super common thing, and it's not something that you should be afraid of. It is really common not to feel that ooey gooey lovey. This is my baby. I couldn't wait to meet you right after birth. A heck of a lot is going on right after the birth and in those first few days. If you do not feel initially connected, please don't think that means that you're never going to have a bond with this baby. I hate to use this phrase, but in a sense, you fake it till you make it. There's a lot going on in those early days. Sometimes you just need to go through the motions, and then generally speaking, it's going to come. You're going to have that. We can talk about our own personal experiences. I've had babies that I was not initially, like it took me a minute, y'all. It took me a minute. And she's probably my favorite now, but don't tell the other ones. But anyway, so don't be shocked by that. It can be alarming if you don't know that it's normal. So.
Yep. And partners, I think this is an appropriate time to address partners too. My husband talks about that, how he didn't feel connected. I think until like 3 or 4 months, maybe. He faked it till he made it. I didn't know that at the time, but I think that is a really real thing. Skin to skin is one way that we hope that facilitates that, if that is something that feels like a good option for you. But you know what? We also have had clients who have said, I don't want my baby put on me right away. I want to, I want the baby to give birth in the bed, and when I'm ready, I want to pick up the baby. I want time to process and slow that process down. So if this is something that you're feeling, you can reach out to us and we can help you, whether it's prenatally and also postpartum. Birth trauma can play a role in that. So if you are feeling something's traumatic about your birth, we have a really good therapist that specializes in birth trauma that we're happy to connect you with. Again, whether it's for partner or for the person who gave birth, both can feel trauma around the birth.
Yep. So trauma is not only for the birthing individual, and I would say even if you have a beautiful seamless birth. So I'm going to throw this out there. A repeat client that we just talked to today, she had a very seamless, rather quick first delivery, and it was traumatic for her partner. He's took him days to realize they had a baby because it all moved so quickly. He didn't have time to kind of process that information. And that was really overwhelming. That's overwhelming for laboring moms. We all hope and we say we want this quick, birth that goes really smooth, but that's a lot to take in on such a short, it's a lot going on, and it's a lot for your body to process. So don't be surprised by that.
And honestly, we're here for you. So like we say about other things, reach out. And partners, if you're noticing something, reach out. We're happy to help with that. It's a very individual experience, and just know
you're not going to ever tell us probably anything that we haven't already heard.
Jackie's had 6 kids, y'all.
Or ourselves before, so there's that. Thanks, Michelle. Okay, raging hormones postpartumly and how it's going to impact their well-being, such a valid thing. Emotional roller coaster and physical effects, how you can go from sweating to freezing pretty quickly. So that is a huge thing. Let me tell y'all, the postpartum sweats for me were always so horrible. Like the worst thing in the world. I don't mean to scare you all, but I like laying down a beach towel on my bed because I'm going to sweat through them at the end of the night, and then having a fan, and then it's a mess, y'all. It's a mess. I hated that so much. And it lasted forever for me. But I have other clients that don't ever have them at all, right? So, right, see? So everybody is so different, and it's really hard to say that this is definitely how your body's going to respond. But we can tell you that this is a pretty common thing that happens. Postpartum shakes or postpartum night sweats is a thing that some people get, and sometimes it lasts for a long time. Don't think there's anything wrong. Just like I said, put that beach towel on your bed so you can quickly change it. Have a robe that you can put on when you start freezing afterwards. Like there's all the things that you can do if it's something that is affecting you. Like reach out and we can give you the tips and tricks and things to survive that a little bit easier.
For me, it was leaking milk. I would wake up in a puddle of my own milk. So you just put get Jim Gaffigan. Have we talked about his like home birth sketch? Well, anyway, when you have a toddler coming in your bed and peeing in your bed at night, you get used to just throwing the towel over that. This is preparing you for it. It's real, y'all. You don't think it's real. You don't think it's going to be you, but it's going to be you. So you just put the towel over it. You move on. Sleep is precious. You prioritize the sleep. What was it? Can you go back? Because that's not one that we can see, Jackie. Can you tell us about the raging hormones part of that?
Yeah, so someone just asked about how hormones will impact their well-being postpartum. We talk a lot of this in the postpartum workshop that's at the end of this month. Hormonal changes postpartum-wise is a huge thing. I would say same thing with everything. It doesn't affect everybody the same way, right? For some people, if you tend to be a more hormonal person, generally, if you have PMS pretty bad or really big hormonal swings, then I would say, maybe prepare for it a little bit. Be aware that it might happen a little bit more so than somebody else. At the 2-week mark, this is the thing that we kind of really talk about. There's a big difference in a normalcy with the roller coaster of hormones postpartum. Within the first 2 weeks, almost anything is kind of normal, right? You're gonna have these high peaks where you feel like you're on cloud 9, and then you're gonna have really dark valleys, and you're gonna be like in the chair crying, saying, all I am is a milk person. Whatever, you'll be all across the board. Totally normal. Crying for no reason, crying over everything. Partners don't totally freak out. Know to expect this. It's okay. When this changes is when you're not able to engage in normal things. When you do not want to get out of bed, when you do not want to eat anything, those are the warning signs that we would say it's crossing a line, right? After 2 to 3 week mark, if we're still having some really significant mood swings or dark days or long periods of times of just not feeling good or happy about anything, that's when we say, please, 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 please do not do a disservice to yourself with not getting care. It is so hard to see families who will just muster through because they think that's what they're supposed to do, when really going to a therapist or getting medication changes it like that. I mean, I cannot tell you how many families that I've worked with as a postpartum doula that at that 3-week mark, they call me in because they're crying, they can't sleep, their anxiety, they're all this. And we talk about seeking care, and they go to a therapist, they get medication, and then they're able to actually experience their newborn. And it's so hard to see families walk that line and not get care when you know that it can make a really, really big difference. It's so, so hard because you're missing out on all those good newborn things and all those newborn stages that you can be experiencing and seeing joy in. So yeah, if you have ever seen a therapist or have ever regularly had depression or any kind of mood disorders in the past, I highly encourage you to connect to somebody now during pregnancy and set up an appointment for that 1 to 2 week mark, even just virtually, that you can check in with. Somebody who's used to seeing you is going to know your routine, right? So don't miss that appointment. Definitely make it. Make sure it's a thing that you commit to. There's going to be a lot going on those days, but it's so well worth it. A lot of them, especially because of COVID, are doing things virtually anyway. So bonus points.
The other thing she touched on, but I want to highlight, is postpartum anxiety is probably almost certainly more common than postpartum depression. So if you're feeling so anxious that you can't sleep, if you're feeling so anxious that you won't let anybody else hold the baby, if you're feeling so anxious that you can't put the baby down, that is a form of postpartum depression, and it's something to talk to a therapist or your provider about. You can reach out to us and we can help provide resources for that. But I think so many times we talk about postpartum depression. Postpartum anxiety can be as or more debilitating, and that's definitely something to seek help about.
We see postpartum anxiety threefold than postpartum depression. So much more than postpartum depression.
Yeah. It's real.
For sure. Ooh, I like this one. I hear that beer can help milk, help get the milk going. That's actually, it's the yeast content. So Guinness, which has a high yeast content, is the best type of beer. So enjoy that dark beer, you know, postpartum. It's a-okay.
So we're going to talk about pumping and dumping with this, because that is a thing that I think has gotten really commonly talked about. Pumping and dumping is the theory that if you drink something with alcohol, then you have to pump and throw that milk away because it has the alcohol in it. That is no longer the recommendation. If you can safely hold your baby, which means if you're not so drunk and you can safely hold your baby can safely have your breast milk. So it's more about you being safe about holding your baby than about the alcohol content in your breast milk. And just like the breast milk or the alcohol leaves your blood, it is the same with your breast milk. So when you're no longer feeling drunk, it's no longer in your system.
It's the amount of actual alcohol that goes through to the breast milk is such a small amount that it's been shown to be safe to drink. And it's actually better to have the drink while you're nursing, not like trying to nurse the baby. I'm going to have a drink afterwards, because it'll take a minute for your milk to process the alcohol that was absorbed. So. And
let's be real, if you have multiple kids, then sometimes the benefit of having the alcohol is going to save you from going crazy with multiple kids. I'm just saying, that's how you survive, y'all.
You'll spend most of the time feeding baby in the first few weeks after he or she is born. Yes, you will. It is every 2 to 3 hours around the clock until at least the first 2 weeks, or until your baby's back to birth weight. So remember, we said we expect baby to lose weight, totally normal. Usually by 2 weeks, by the 2-week mark, we would expect baby to be back at their birth weight. That's what our goal, our lactation goal is. Until then, or if your baby, well, definitely until they're back to birth weight, or at least 2 weeks old, we would say 2 to 3 hours around the clock. If you are blessed with a nice, big, juicy, chunky baby who weighs 9 pounds, this is my personal opinion as a lactation counselor, say that letting your baby go a longer stretch overnight, once we know that baby's gaining and has an appropriate intake, is totally fine. By that 2-week mark, we can usually say, let your baby dictate. If your baby wants to eat, your baby's going to let you know it needs to eat, right? So those are kind of my personal guidelines. So yeah, take that to the bank.
I'm all about practicality also. Yep. That's a really good question. Oh, you know what? Here's how I say this in a simpler terms. If your baby is awake in the first 2 weeks of life, it is only waking up to nurse. So if your baby is awake, breast is the first option. If your baby is crying, breast is the first option, because in those first 2 weeks, really the ideal is to establish a good milk supply. And so nursing frequently is going to be the key for that. The more you're going to make more milk, the more milk you remove.
Yeah, this brings up a really great point. I'm glad you just said that. Understand, when your milk supply comes in fully in the first 2 to 5 days, this feeling of engorgement or swelling or heaviness in your breast is typically what you hear. It can be quite uncomfortable. It will be astonishing when you look in the mirror and you have tripled in size. It is like shocking, and they're very heavy and full and uncomfortable. Does every woman have this engorgement sensation? No. Do most women have this engorgement sensation? I would say, yeah, probably most, but that doesn't mean that you do or do not have a milk supply. If you take the milk out of your breast, your body's going to reproduce it. So in those early days, those 48 to 72 hours of feeling pretty swollen or uncomfortable, try not to pump or express the milk unless it's your baby needing to eat it, because your body's just going to reproduce that extra milk. So whatever comes out is going to be reproduced. Does that make sense? So if you deal or you manage the discomforts that you might have in the early days for the 24 to 48 hours, generally that's the most uncomfortable part, then it will slowly taper off. If we keep taking it out, you're just prolonging the engorgement sensation.
Yeah. But also after a few weeks, that sensation goes away, and a lot of people freak out feeling like my boobs are no longer big and heavy, I don't have enough milk. That's not necessarily the case. That's just your body regulating itself. Yeah. And so if you're concerned, am I making enough milk? We're going back to poops and pees. We're going back to weight gain, and not necessarily that engorgement feeling is not what determines your milk supply.
Right. Good question. I've heard it's painful to wipe, so you should use a peri-rinse and then dab. Yes, that is correct. So often, and this is more so if you've torn or you have perineal trauma, even if it doesn't need sutures, that area after it's being stretched, or if there's any tearing, or some of the midwives, I hate this term, call it skid marks, so like an abrasion on the perineum but not quite a tear. When you pee, your urine has ammonia in it. When it touches those open wounds, it's gonna burn like hell. So using a spray bottle that the hospital will give you every time you pee will help dilute the ammonia so that it's more comfortable to pee. You can also have some of those tears or those abrasions up near the urethra. So there's lots of different things. Sometimes a technique or a trick that you can do is peeing in the shower. So that way the water is hitting it. Sitting on the toilet backwards. So if all the tears are on your actual perineal area, you can sit on the toilet backwards so the urine is hitting closer to the front of your vagina. And that can help a lot if you're feeling really, really uncomfortable. Typically just using the peri bottle to dilute that, the urine and the ammonia, it feels better. So, and we don't wanna wipe because you're gonna disrupt any healing process that happens from the tears. Big soapbox of mine, y'all. Please understand, especially when you're tearing and you have sutures. If you are going upstairs, what are you doing? You're stretching the tears. You're stretching the perineum and the sutures and disrupting the healing process. If you have tears and sutures, please try to limit the amount of stairs you're doing. Nobody should be going for walks around the block. If you live in a 2-story home, hopefully you have a bathroom on each floor. If not, please stay put for at least the first 5 days in one area on one floor. I mean, I cannot express, honestly, if you take the first 10 days to do next to nothing but feed your baby, then you're gonna make the next 3 weeks of healing so much easier. Cannot express it enough. So that's my soapbox. Somebody asked, so you hear that you need help from family if you're a first-time mom, even if you have a partner that will be with you. I would say no, you don't need anything, right? You technically have everything your body needs and your baby needs. If you have a really good partner, you shouldn't need any outside help as long as you guys communicate and have a good working team. So moms should be feeding babies if you're breastfeeding. Partners should be doing all the other things. And you guys should not pay attention to a clock. If it's 12 noon and y'all are tired, go take a freaking nap. You should be napping all day, every day in the early weeks. There should be no time where it's not appropriate for you to sleep. So it actually makes it a little bit easier when you don't have family near you, because then they're expecting things from you or expecting time, in like it's dinner time, yada, yada, yada. So yeah. I don't know. What do you have?
I would say, here's my response to that. If the person who is visiting you, whether it's a grandma or a family friend or a sister, is helpful, meaning they're not expecting to hold the baby, meaning they're gonna do the dishes because there's dishes in the sink, or they're gonna fold the laundry or actually they're gonna go into your room and take all the dirty laundry and put it in the laundry and fold it.
You sweat it all over.
Right, because you sweat all over and then the baby puked and breast milk's leaking everywhere. That can be helpful. If your family member is somebody that you have to go get a glass of water for, or that you are afraid of offending, those are not helpful.
Or if you have to go in another room to breastfeed.
You can't be topless in front of them. Not helpful. There was one other thing I was going to say. Oh, here's the other thing. If you're somebody who, I'm going to say this, but I mean it in love, because you know I love all of my type A people. If you're type A and you need your house to be clean, and you can't have dirty dishes, and you can't have dirty laundry, and your house can't be messy, then you might be somebody who wants to have somebody to come and do those things for you.
Just put shades on, y'all. Just don't look. Just don't look in the kitchen and it'll be all right.
Jackie.
It's insane.
You know, we live in DC.
I do.
If you guys could see my bedroom right now, the chaos that you have to embrace to some degree to have kids is real. But if that is going to cause you postpartum anxiety, then having somebody to come and help manage those things who doesn't need to be told what to do is beneficial. Well, we've talked a lot about that. We're running out of time. Where's Ashley? Okay.
We are? Okay.
Yeah.
Thanks. Okay. We heard that you bleed a lot and how much is too much. Postpartum bleeding actually doesn't bleed that much. So in the first week, it should be like a period on average, although it's mixed with blood and Loki and lots of other vaginal dischargey things. So don't.
Not the Avengers Loki.
No. Is that a Avenger thing?
Yeah.
Okay. Anyway, so that within the first week, normal, you would need a postpartum pad. They'll send you home with these ginormous granny panty looking pads that are crazy. A lot of women now are using Depends just because it's easier. That catches it all because you're laying down and you're not as comfortable, which is fine. That's your choice. If you're soaking a pad and saturating a pad more than a pad an hour or even every 2 hours, please talk to your provider, talk to us. Let's talk about things. I have too much experience, unfortunately, with hemorrhaging and postpartum. So I know what this looks like, and I know the things that you'll look for in the warning signs. So if you're bleeding or saturating a pad more than in an hour, you're changing that pad every hour, that's a concern. If you're bleeding like a normal period, totally fine. Typically within the first week, that bleeding is going to subside substantially. Almost like this is what the most annoying part I think of the postpartum period is, because it just lingers. You need like a panty liner for like 4 weeks. It's kind of obnoxious. It just kind of lingers on for a long period of time. So those are the things. This is another one of my soapboxes, y'all, because I want you to understand what's happening. And hopefully some of you, well, whatever. Your uterus, right, is what held, I wish I had my placenta. The placenta is about 12 to 18 inches, right? It's attached to the uterine wall. When you deliver that baby, within the first 30 minutes or so, your placenta is going to detach, and that is now an open wound that needs to heal, right? So you have a 12 to 18 inch wound inside your uterus that is going to be clotting and healing. One of the key ways your body's going to tell you if you're doing too much postpartum is that your bleeding is going to increase. So if your bleeding has next to stopped, it's 4 days postpartum, it's really, really minimal, you start feeling great, you go for a walk around the block, you come home and you start passing clots and you're bleeding a lot, hello, warning signs. Your body is trying to tell you to take a step back. You really shouldn't be doing anything. You should be resting in bed still for another 5 days. So, or, you know, in the living room watching TV and binge watching stuff and eating great, good food. So that's my thing.
Does anybody know what size of clot is appropriate postpartum before we're concerned? Golf ball. Yep, good job, Jocelyn. Golf ball size clots postpartum are normal. Anything more than that is you can reach out to us or your provider, but we'll tell you to reach out to your provider if you're having anything more than a golf ball size.
Yeah. Clots the size of walnuts, small clots, normal, typical. We're used to seeing that. You're going to feel the blood, especially in the very early 24, 48 hours of postpartum. You're going to feel blood gushing out of you. It's going to feel quite substantial. Understand that when you're sitting, that blood is all pooling there, right? So anytime you move or when you go to stand up, you feel a good gush of blood, that's common. That's to be expected. If those gushes of blood are happening all the time, not to be expected, y'all. Not okay. So that's when we kind of want to pay attention to it.
It's also fascinating. I love the body. It's so amazing. But if you have like a golf ball size clot in there, it is common for your body to have an increased amount of blood because your body is trying to get rid of that clot. Then the clot comes out. The normal would be for the blood to subside and back down. If after that clot has gotten out, it's still a heavy amount of blood, again, reach out to us. But it is common for the body to almost push it out because it will bleed a lot. Clot comes out and then it stops. It's fascinating.
Yeah, it is. How long lasting I can never say this word right.
Recti.
So the separation of your abdominal muscles happens for many pregnant women, and the side of your core is really what's going to help decrease the amount of that separation, right? Does everybody have it? No. Is it common? Yes. The best way to help reduce the severity of that and allow it to heal is really being gentle with yourself postpartum. So no, don't do sit-ups. That's not going to help you. That's actually going to make it worse. So rolling to the side and getting up and trying to not use the main core of your abdominal muscles will actually help them heal quicker. So trying to be really mindful about your movements early on is going to be helpful. I don't know this for a fact, but I have a feeling it's genetic, right? Is that genetic?
I think it can be size of baby, it can be genetic, it can be fluid levels, it can be like poor core.
Yeah, I don't know if there's a single way that we can say to reduce the chances of you getting it. I think a lot plays at it, but we would say we should follow some of the things that the Europeans do, and every new family should be going to a pelvic floor therapist and a PT therapist 4 to 6 weeks postpartum, because that's going to be where you are. Also, warning, don't do any of these physical activities. Do not try to get back in shape or lose baby weight or any of this stuff, at least until 6 weeks postpartum, until you get cleared by the midwives. You going for walks or running at 4 weeks is actually not going to help the scenario. You're going to hinder it. I had a mom, oh, I love this woman so much. She was like one of my favorite clients. Anyway, she was really a very fit person to begin with before she got pregnant. She stayed fit during her whole pregnancy, had a beautiful birth, got cleared to go back to fitness. And then as soon as she started working out, backtracked, and she had to stop 6 weeks later. So it's a lot for individuals who mental health wise, fitness is their thing. We get it. We see it all the time and we appreciate it, but it is not going to help when you have to backtrack. So please don't jump the gun. Don't do it before you get cleared. Listen to the way your body's responding. If it doesn't feel good when you start doing it, please stop doing it. Your body's trying to tell you guys something.
Also, this might be a little hard to hear, so I say it in love. Remind yourself it took 9 months to grow this baby and for your body to develop this way. Expect it to take about 9 months to go back to pre-baby. Yeah. Also, Mama Strong is a website, online resource for physical therapy type activities postpartum. So Mama Strong, it's a $5 a month membership, and we've had really great recommendations from that website. So
hand expressing prior to
she has a pregnancy series too, says yes, she does have a pregnancy one. So if you're wanting to do that, that would be a really great resource.
Hand expressing prior to breastfeeding, it's not going to necessarily help your milk come in or help anything. If it's reassuring to you to know that your milk's there, I would give you a warning. After 37 weeks, hand expressing or any major nipple stimulation can cause preterm labor or contraction. So please be gentle with yourselves. Please don't go overboard. You do not need to collect your milk before your baby's born. Unless you're gestational diabetes, then please reach out to me so we can have a conversation. That's all.
Yeah. The other thing is it might not put you into labor, but it can cause your uterus to get angry, and then you just cramp and are grumpy.
Yeah, it doesn't, don't do it too much. If you're in the shower and you'd want to try it every now and then, like just to ensure that you have colostrum, go for it. It's not a bad idea to learn how to hand express prenatally. I would just be really cautious of causing labor.
And Stanford has a really good hand expression how-to video that's really helpful. So if you want to experiment with that and try that out, just Google Stanford hand expression. That's a really great resource. And it also shows you like how little you actually need to collect to satisfy a baby in those early days. Great resource.
It's so, I hear all the time when someone says, oh, I don't think I have any milk or I don't have any colostrum, and they go and try to hand express and hello, it's right there. And you're like, oh my gosh, I didn't even know that was there. So yeah, it's kind of cool. Oh, how do you prevent clogged ducts? One of the best ways to prevent clogged ducts is leave your breast alone. Please don't wear tight-fitting clothing, especially in the early days. And that's probably number one reason. If you think of a hose, right? If you think of all these milk ducts and these hoses, and allowing your milk to go through them is going to help them. If we block those ducts by wearing a tight-fitting bra or holding your breast the whole time you're breastfeeding, you're actually eliminating the fact of allowing that milk duct to release. Right? So that's going to cause a clogged duct. Prolonged not nursing. So if you're nursing regularly and you skip a feed because you have family over, you're going to a barbecue or something like that, and all of a sudden you have this big engorgement, that's going to be uncomfortable for you, and that can cause a clogged duct. I don't want to say clogged ducts are normal. I would say it's a common complication that we see. Generally speaking, it's pretty easy to fix. Please reach out to us. We're here. We can give you all the tips and tricks to let it pass easily. Don't ignore it. That's probably one of my biggest things. If you feel like something's not right, or if you have one spot that's not releasing after you're breastfeeding, then you need to start working on it. And there's lots of things that we can do to release that milk. Man, I felt like that was like a speed dating thing or something. I felt like we just really went through that quick. Not that I did them all.
We still have one.
Oh, do we?
Mm-hmm.
What?
Oh, yeah, hand expressing. Oh, yeah, you got it.
Hello?
Yes, okay. The only thing, guys, we covered almost everything on our list just by you all, which is super exciting. Let me check Ashley's list. The hind milk, fore milk thing for Ashley.
Yeah. If you guys haven't, I hate this thing so much. This whole concept of hind milk and fore milk, you might hear, all right, so first, let me step back for a second. Lactation consultants, we all have something different to say. We've all been trained at different times, and breastfeeding medicine changes constantly, right? So Ashley and I are both CLC trained by the same organization, and we both have very different information and different theories of how we work, right? Doesn't mean she's better than I am or I'm better than she is. It's just different philosophies and ways to go about it. There were over the last few years, there's this big push about hind milk and fore milk, about your baby being breastfed on one breast, and they're going to get the fore milk first, and then you have to keep baby on there for a long period of time so they can get the hind milk that has the higher fat content. BS, y'all. It's total BS. It's been rebunked. There's studies on it. There is no way to tell when your body is going to transition from fore milk to hind milk or what your baby needs. Trust that your bodies and your baby is going to take what they need. So please don't listen to that. If you have a lactation consultant or a doctor or somebody who says that, if it feels good to hear it, then fine. If you're questioning it, please call me and I'll reassure you that it's not true. So that's kind of my stance on it.
I think what she's saying though is really important. And here's our advice. Everybody, every lactation consultant, every pediatrician, every grandma, every aunt, every cleaning lady at the hospital is going to tell you something different. There are cleaning men at the hospital too. Okay. So whatever, clean person, people. Here's the thing. Take all the information in, smile and nod, pat them on the shoulder and tell them thank you, and then do what feels right for your family. Because especially around this postpartum period and especially around breastfeeding, there are so many ways to achieve the same goals, but it's figuring out what is unique for you and your family and your baby. And so for us, we will each tell you different things, different tricks, different paths to the same goal. Take what feels right, try them all if you want, but then really just know that this is the beginning of parenting, and parenting really just looks like smiling and nodding a lot and then doing what you want to do.
Yeah.
Ask Jackie, she has 6 kids.
I just didn't even answer. Are you kidding? I just pretend like I don't hear them. But I will say it can be really, really frustrating in the early days postpartum. That first week, especially when there's breastfeeding challenges or there's weight gain issues, it's so overwhelming and you really don't know who to listen to and you're just trying to do the right thing, but 5 different people are saying different things. It's hard, y'all. So generally speaking, as your doulas, we're not going to give you unsolicited advice, right? If you are going to a pediatrician and you are working with their lactation person and you're feeling comfortable about that, we're going to say, great, we're going to let you carry on. If you're like, well, I'm just not sure, this is what they told me, but is that what I should be doing? Then we're going to say, what are your goals today? What is your goal right now? Let's work through that. Do you want to hear my, suggestion? So it just really depends on what you feel. I just know it's super overwhelming to me to hear lots of different opinions. And I know for a lot of families in the postpartum days, because everybody just wants to do what's right. You just want to do what's right for your baby and make sure that they're being fed and that they're healthy. And yeah, it's hard. Parenting's hard still.
So hard. It's so good. Wait, it's so good and lovely and all of the things. Yeah. When you don't wake up covered in your night sweats and your blood and your breast milk all the time.
Yeah, but you do, but then you roll over and it's your sweet baby smiling at you finally, even though it's just gas in the early days, and that's okay because it still feels good. And they smell really good and they're soft.
And they don't talk back.
No, and then you go into your 14-year-old son's room and it smells horrendous. Anyway, I'll get off that. Boys are smelly. Okay. Yep. I think that's all. Questions, comments, concerns? I'm sure girls are no, my girls don't smell like that actually. Well, my one daughter does. Anyway. Yeah.
We have gone over, and Ashley would have been texting us a long time ago to say this. So.
We're only 10 minutes over and we started 10 minutes late, so that was only fair to them.
Okay.
Okay.
Any other question? Oh,
yeah.
What a night might look like. Oh, Megan.
Go for it, Michelle.
So a night might look like, first of all, let's start the night at 5 p.m. where your baby cluster feeds for 4 hours straight. Look, let me say this first though. The first nights are really hard. It does get easier. I'm sure. My 10-year-old still doesn't sleep through the night, but I'm sure eventually he will.
Okay, so let me just put this in perspective. All my guys, this is probably why I have 6 kids, slept really great. So by 2 months, almost all of my babies slept through the night. So
there's literally never been a day when no, that's not true. I think I can count on one hand in the last 10 years when I've not woken up with somebody in my room. Okay. So at 5 p.m., they're going to cluster feed, which means like literally constantly nursing for the first, like nurse for 20 minutes. And then you think they're asleep and you put them down, and then they wake up and then they nurse again for 20 minutes. And then you think they're asleep and you put them down. That happens from like 5 to 9 p.m. And then at 9 p.m., they finally go to bed and you think, oh, great, I'm going to do the dishes because I need to do the dishes.
Your partner is doing the dishes.
No. Listen, I'm going to say, and you're going to be like, nope, my doula's told me I should not do the dishes. The crusty stuff still comes off in the morning. I'm going to bed. And you're going to go to bed, and at this point, your baby's is not back to birth weight. So somewhere between 2 and 3 hours, you're going to set an alarm, and you're going to wake up, and you're going to unswaddle your baby, and you're going to change your baby's diaper. You're going to put your baby skin to skin, and then they're going to nurse for like 20 to 30 minutes.
45.
25?
45.
45 minutes. And you have to start that every 2 to 3 hours from the start of a feed to the start of the next feed. So after 45 minutes, you're going to go to bed, then do the math, because I can't do the math because I haven't slept in 10 days.
2 hours, 15 minutes.
Okay. Then you're going to wake up again and you're going to repeat the process. Except for some of you are going to have babies, which we didn't talk about, who will only sleep when somebody is holding them. This is normal. This is okay. Your baby has been touching you for 9 months. It doesn't know how to do anything unless it's touching you. Some are 10 years and they still do that. So then that means your partner and you are going to take turns, or you're going to figure out what the best solution is for you. Call us and we'll offer alternatives. So maybe that means you're going to sleep now for 2 hours and 15 minutes while your partner holds the baby for those 2 hours and 15 minutes. Then you're going to nurse the baby again. Your partner is going to sleep for the 45 minutes while you're nursing. Rinse and repeat. Until you get to the morning when finally
the same thing still happens.
The same thing still happens, but instead of every 3 hours, it's every 2 hours. I really say that like facetiously / it's kind of true, but just know it's normal. It gets better. Eventually, they don't wake you up when they come into your room.
You will learn to sleep and nap as you're nursing, right? We don't want you to sleep unsafely with your baby, but there are ways to still relax and rest while you're breastfeeding to still gain some like downtime and some, sleep.
Yeah. And eventually your baby gets faster, your milk comes in, and so that process goes faster. Your baby gets bigger, it can remove the milk. So we're not talking about 45 minutes. We're only talking about, 10 minutes. And they're sleeping
20. Who nurses for only 10 minutes? Did you nurse for only 10 minutes ever?
Some people. But then your baby is sleeping for longer stretches of time. Once they're back to birth weight, you're not having to wake them as frequently. So if your baby does sleep for 4 hours at a time, then you get a good 4-hour chunk.
The 4 to 5 hour, when you can sleep for a 4 or 5 hour stretch, game changer, y'all. You can maintain that for a long period. Many people can maintain that for a long period of time. Those first couple weeks until your baby hits back to birth weight and we know that they're gaining and your milk supply is established, those are the harder times. Once your milk supply is established and we know baby's gaining and doing well, then you're going to let your baby wake you up instead of setting alarm, right? Your baby's going to tell you when they need to eat. So if they get a 3-hour stretch, a 4-hour stretch, you get blessed with a 5-hour stretch, sweet. It does add up and it makes sense. I'm sure you've heard this, or if you haven't, you should have. Sleep when baby sleeps. We can't express that enough. It doesn't matter what time of day or night it is. If your baby is sleeping, especially in the first 2 weeks, please go to bed. Get those darkening curtains, go lay down. I use the rule of thumb that if you are a person that needs 8 hours of sleep, don't get out of your bedroom in the morning or during the day until you've accumulated 8 hours of sleep. Even if that's 4, 2-hour chunks, that's fine. It all adds up. It's worth it. But it makes a difference. And if it's hard to nap, I'm not a napper, but try to learn how to nap now, y'all. It'll serve you well in the early days. Napping is amazing from what people tell me.
Shout out to all the nappers. Also, I want to say James McKenna out of Notre Dame is the leading researcher on safe bed sharing. Whether you bed share or not, that journey is different for everybody. We are not here to tell you what is right for your family. We are just here to tell you, you will fall asleep at some point with your baby. The research shows it is safest in your bed. So please look at his guidelines for how to set up your bed safely. Yes. James McKenna is the leading researcher out of Notre Dame, and he will help you set up your bed safely for the inevitable times that you accidentally fall asleep with your baby.
Yeah. Definitely shout out to all the Megans as they realized how much.
I know.
It's crazy. The other thing is
Make sure you tell us when you call us which Megan you are.
Well, yeah. It's not even just Megan S. It's like Megan SP or Megan SM. Anyway, something else I was going to say. Crap, where was I? Oh shoot, I don't know.
Anybody have any other questions before we let you all go for your Sunday evening? Thanks for being flexible. We just realized that we are already doing things on Sundays and might as well compile it all in one day. It's like a game changer for us.
Maybe. I'm exhausted. It's been a crazy week. COVID updates, still just Nova hospitals and Virginia Hospital Center are the only ones that are allowing doulas. We're hoping things start to open up again, or more so in the city, but that's where we are.
We will let everybody know as that comes about.
Yeah. Crap, what was I going to say? It was something I thought was important. Must have been a lie is what my mama's mama would say.
Okay, well, if that's it, thank you all for joining us.
Yeah. Nice seeing everybody. Thanks for having your camera.